Upon assumption of his second term in office, President Donald Trump announced a stop work order pause on U.S. foreign aid for 90 days to allow for a review. The announcement automatically affected the HIV/AIDS response in African countries that largely depend on this funding to keep the disease at bay. However, an emergency humanitarian waiver was granted for the treatment across 55 countries, including Nigeria. Family planning and other reproductive health services in the country are at risk as they rely majorly on foreign donor support to get commodities like condoms, pills, and other modern-day contraceptives. Coming down to Edo State, residents, including those in the medical field, are worried about the potential dangers this poses for the public health sector in the state and across the country, especially if the funding is totally stopped after the 90 days review.
Because we have been talking about domestic resource mobilization over the years and attention has not been given to it, but this is a call. Are we going to call it positive or negative? Positive on the part that it is a wake-up call to the Nigerian government to do what they are supposed to do. Negative is that those who are already on treatment, they will definitely suffer.
NGOs used to embark on it by going to communities, sensitize household on what to do. Now that funding has been reduced, it will be a challenge to non-governmental organizations who don't have a means of generating income to carry out such activity. And when they are going out for such activities, before they used to go with some commodities like male and female condom, which they give out to those that they attended to. But as it is right now, many of them cannot afford it, and this will now lead to increase in population coupled with the economic hardship. And some parents that cannot afford to take care of so many children, if they don't control if they don't plan their family from the onset, they will give birth to children. At the end of the day, those children will become nuisance in the society.
They suggest some ways the Edo State government could step in to ensure that the present pause in foreign aid does not have an adverse effect on the reproductive health sector.
Government should prioritize what is it that is their major concern. Then they can get the money. So they will have to source the money and deprive other things from not being subvented to, but move the money towards those priority areas in health that we can now forget about what was coming from outside and then begin to move forward.
The state should kind of do a kind of a baseline assessment to know what is on ground. Then they should also check for partners who are available domestically, not foreign partners for now. Then we should also look at the ecosystem of our reproductive health and other things that are on ground and see to what is actually the need. So an holistic need assessment needs to be carried out so we know what the needs actually are. Then government can begin to make provisions for those services as they are needed.
Those in the sector who are already into this intervention should have a role to play too by carrying out advocacy to relevant government agencies for support so that they can reach out to community members who need this service. Government also can still set up pharmaceutical companies where they can be producing drugs like ARV for people who are infected with HIV virus and subsidize the price of these drugs so that they can afford it, because majority of those infected cannot afford the medication.
It is their hope that immediate steps will be taken to protect the public space in Edo and across Nigeria. Osaose Sado, Ait Benin.